Good morning, everyone. I wanted to thank you all, first of all, for attending this training. My name is Carletta Cole, and this is our first live training. I am the founder of Caregiver Safe Place. I just want to thank you for taking the time out on this great Mother's Day weekend, and happy Mother's Day to all the mothers and the fathers that are mothers. Thank you for taking the time out for yourself, first of all. Today is our first conversation and workshop. Well, we'll be hosting for support for family caregivers emotionally, mentally, and spiritually. So I basically wanted to make sure that I did this workshop so that all of the family caregivers are felt seen and heard. It's something that's really dear to my heart. I was a caregiver of my mom who had supranuclear palsy, which is a part of dementia, part of Parkinson's that causes dementia. And so I too understand the stress and the strain of being a family caregiver. Today, the conversation and workshop will be hosting supports family caregivers that really need that support group. So I just wanted to make sure that I tell you, great job for even attending this, because I know sometimes it's not easy to feel as though you're a caregiver. You just know that you're doing what you need to do for your loved one. So I want to make sure that I acknowledge and introduce our first guest speaker, Dr. Shannel Elhelou. She's a clinical psychologist who specializes in neurological health and caregiving support. She is sharing insight about what's happening neurologically with people you care for, and how to understand, and how understanding this can make your job a little bit easier, less confusing, and more compassionate. Let's give her a warm welcome.
Thank you, everyone. I'm thrilled to be here and be able to talk to you all and present a bit on some neurological conditions that we tend to see. And so first, I just want to introduce myself. So my clinical focus is on neurodegenerative diseases and memory disorders, and particularly dementia. And a large part of what I do involves neuropsychological testing, which helps identify subtle cognitive changes often before a formal diagnosis of dementia is made. And early detection really allows us to intervene sooner and develop strategies to help slow decline and preserve quality of life. I also provide therapy, and I approach it through the lens of acceptance and commitment therapy, also known as ACT. And my goal is to help people, even in the face of neurological change or caregiving, live in alignment with their values and purpose. I'm especially passionate about caregiver support. I run caregiver support groups and truly believe in the power of community. Caregivers, as you all know in here, are often the unsung heroes in this journey. And so I consider it a privilege to support you as you support your loved ones. Now, let's get into cognitive changes. So, some cognitive changes are age-related, right? And so dementia, it's not considered part of normal aging, but changes in cognition are part of a normal aging process. So really the difference here are the declines tend to be subtle. However, aging increases the risk of developing neurodegenerative diseases. Now, there's also accelerated cognitive decline, or think of it as accelerated aging. And that's cognitive changes that are beyond normal aging. And so this might look like some short-term memory loss. Not really, where did I put my keys? We all have those moments where we'll misplace something, but we really want to think of it as a rapid loss of new information. Changes in thinking abilities, so like the ability to problem solve, and even changes in navigating, like getting lost in familiar places. You also might see some inappropriate social behavior, personality changes, and changes in motor abilities like increased falls, tremor, or changes in balance. And the expression of these symptoms really varies based on the individual and the cognitive disorder type. Now, something to note about dementia, like I said, risk for dementia increases as we age. And most cases of dementia include people age 65 years and older. And the research actually shows that dementia impacts about 40% of individuals over the age of 85. Now, something that I really want to highlight here is lack of treatment or even knowledge that a disorder exists could accelerate the decline. And then there are some risk factors. So age, genetics, ethnicity, cardiovascular factors, traumatic brain injuries. Think of things like high blood pressure, high cholesterol, history of smoking, not exercising throughout your lifetime, and a family history of dementia. There's a particular gene for dementia. It's called APOE4. And so we all have either a 2, a 3, or a 4. We get a copy from each parent. Those that have a copy of the 4 have an increased risk of developing dementia. I also really want to highlight stress, depression, and social isolation as a risk factor, as well as poor sleep, nutrition, and reduced cognitive stimulation. So you really want to think of the way you take care of your body as medicine, food as medicine, stress management as medicine, sleep as medicine. These are the ways we take care of ourselves. Now, there's a growing body of research suggesting that behavior and well-being during the amnestic mild cognitive impairment stage of the disease has a great impact on the disease progression. So what's that mean? When we're first getting our diagnosis, and maybe we're in the MCI phase, before we've transitioned to a dementia phase, the behaviors we do then make a big difference. So think of exercising your brain, reducing your stress, exercising your body, eating healthy, sleeping. All these things make a big difference. Now, dementia can fall into stages. There are different models, but we tend to look at a 5-stage model for dementia. And so you really want to think of this as a gradual condition that affects a person's memory, thinking, and ability to do everyday tasks. So understanding the stages of dementia can really help caregivers know what to expect and how to provide the best support. And so here's a simple breakdown of the 5 stages. So think of stage 1 as no impairment. So as of now, there are no noticeable changes in memory or thinking. People are fully independent in their daily activities and everything is functioning as usual. Then we have a very mild decline. So stage 2. This is the stage where you might begin to notice light forgetfulness, like misplacing items or forgetting names. These changes are often subtle and can be mistaken for normal aging. So at this point, the person's still able to live independently and carry on with most of their daily tasks. Stage 3 is where we're seeing a mild decline. So here, memory problems become more noticeable. The person may struggle to remember names, appointments, or familiar tasks. They might find it harder to plan or organize activities, and they may need help with some complex tasks like handling finances or cooking, but they can still perform many daily tasks, but just need some assistance. Stage 4 is where we see moderate decline. And so in this stage, the person has clear memory and cognitive difficulties. They may need help with daily activities like cooking, dressing, or managing medications. Confusion may increase. They might forget significant details like their own phone number or names of close family members. And in this time, it's important to offer more support and ensure safety and comfort. Now, stage 5 is where we're seeing a more severe decline. So this stage represents significant cognitive and memory loss. The person will require full-time care for basic activities like eating, bathing, dressing, and moving around. Communication may become more difficult, and they might not recognize familiar people. And safety and constant supervision are key. Now, I'm going to go through some specific neurodegenerative disorders. Alzheimer's disease is the most common form of dementia, accounting for 60 to 80% of cases. It's a progressive disease that primarily affects memory and thinking. Early signs often include memory lapses, like repeating questions, misplacing items, or forgetting conversations. Over time, the changes become more noticeable. So you might see some difficulty with problem solving, some disorientation, and eventually challenges with speaking, walking, and recognizing people they know. But it's important to know that these changes are due to damage in specific parts of the brain, particularly within the hippocampus, which is we call it our memory center. Really, it's our learning center. That's why we lose new information. And it's not something that your loved one is choosing or can control. It's always important to remind ourselves of that. And early diagnosis and creating structured routines can really help both the person with Alzheimer's and the caregiver adapt more smoothly. We also have vascular dementia and stroke. So vascular dementia is the second most common form of dementia and is caused by reduced blood flow to the brain, which could be due to strokes or small vessel disease. Unlike Alzheimer's, the symptoms can appear suddenly, especially after a stroke, and they progress in a stepwise fashion. So that means that cognitively, they may be right here, and then they have a quick decline, but then they hang out here for a while. And so people may experience slowed thinking, difficulty planning, mood changes, or motor issues. And really, people that are dealing with a vascular process should be mindful of their medications and lifestyle changes. That's important for everyone, but especially those with a vascular process. We also have frontotemporal dementia, which we often refer to as FTD. It's less common, but tends to affect people under the age of 65. So usually has an earlier diagnosis. It involves degeneration of our frontal lobes and our temporal lobes, which control behavior, judgment, language, and emotion. Families often notice personality changes first with FTD. So you might see things like impulsivity, apathy, inappropriate comments or behaviors, maybe a loss of empathy. Others may experience difficulty with speaking. There's another term for it called primary progressive aphasia. And FTD can be especially challenging emotionally because the changes are not always about memory, but how the person behaves and interacts. And again, remember, this isn't necessarily bad behavior or something they're trying to do. It's really a process that's driven by their brains due to parts of the brain that are changing. And this can be especially challenging for caregivers. Caregivers have a big job, and it's hard managing memory difficulties or the ability to manage their everyday tasks. But whenever we see that change in behavior, it can really lead to an accelerated burnout within the caregivers. And if anyone has any questions throughout, feel free to put them in the chat. Now we have aphasia. So aphasia is a language disorder that happens when there's damage to areas of the brain that control speech and comprehension, often due to a stroke or neurodegenerative disease like FTD. And so there are different types. We have expressive aphasia, where someone knows what they want to say, but they can't get the words out. And then we have a receptive aphasia, where they may not understand what's being said. And then global aphasia, which really impacts both. So it's important to understand that aphasia is not a loss of intelligence. Your loved one still has thoughts and feelings. They just may not be able to express them in the same way. So using visual cues, simple language, and patience can really go a long way in reducing frustration for the both of you. And there's Parkinson's disease. So Parkinson's is primarily known as a movement disorder. It causes tremors, muscle stiffness, and slowed movement. But over time, it can also affect thinking, memory, and mood. Some people with Parkinson's develop Parkinson's-related dementia, which can include confusion, trouble concentrating, and changes in personality. It's important to watch out for both motor and cognitive changes over time. And then we have Lewy body dementia. And so this is a progressive brain disorder caused by abnormal protein deposits called Lewy bodies. And this affects cognition, movement, and mood. The big thing with Lewy body dementia is the fluctuating cognition, the visual hallucinations. So people with this, a sign that it's a Lewy body dementia process is often people will see things like they will perceive a person, or they'll think there are animals or children that they're seeing, but they're not actually there. It also comes with some Parkinsonism, so tremors and stiffness, and sleep disturbances. So maybe they're acting out their dreams or flailing their arms in their sleep. And then it also comes with changes in mood like depression and anxiety. Now, I touched on this before, but one of the hardest parts of caring for someone with a neurological condition is managing emotional and behavioral changes. So you may notice irritability, apathy, depression, anxiety, or even paranoia. These are often symptoms of the condition, not intentional behaviors. So it can be especially painful when someone's personality seems to change. Know that it isn't your fault or theirs. So providing structure, staying calm, and validating their feelings can help. And in some cases, medication or therapy can be helpful too. Now, the role of the caregiver. Each of you in this room know this role better than I can explain it. But as you may experience being a caregiver, you wear so many hats. You're the nurse or the doctor, the advocate, you're the emotional support system, the financial planner. And often you're doing this while managing your own life and health. It's a role filled with love, but also stress, uncertainty, and exhaustion, which is why support's so critical. But you don't have to do it alone. I really advise that you don't. The earlier you reach out for help from professionals, friends, or support groups, the more sustainable your caregiving journey becomes. It's hard. It's something that we really shouldn't tackle alone, although many of us do, but community makes a big difference. Now, daily care strategies. Daily life can feel overwhelming, but small adjustments make a big difference. So routines, they actually provide comfort and predictability for you and your loved one. And breaking tasks into small, manageable steps can help your loved ones feel successful. So try to maintain their independence wherever possible, because it really supports dignity and confidence. And so if it's something like helping them unload a dishwasher or helping them set the table or doing tasks together, that's something that's helpful for their own cognitive functioning because they're being stimulated. But also it can make that process a little bit more difficult because I often hear from caregivers, it's just easier if I do it myself. And so really managing that. But think of each day as a rhythm rather than a schedule. So you want to have a routine, but it is important to be flexible. Now, tips for communication. This is a big one. So communication changes can be frustrating for both of you, but there are a few strategies that can really help. So speak slowly and clearly, use visual cues and gestures, break things down into one question or instruction at a time. And most importantly, validate how they're feeling. So instead of correcting or arguing, try redirecting or offering a calming distraction. Remember, connection matters more than correctness. So your tone, facial expression, and patience speak volumes. And whenever we become frustrating, it can be very contagious. So it might actually make our loved ones frustrated too. Now, when your loved one is agitated, confused, or resistant, it's often because something has triggered them. So they may be tired, overstimulated, in pain, or afraid. Try to identify those triggers, then use redirection instead of correction. So, for example, if they want to go home, instead of saying you are home, say, let's have some tea first, and then we'll talk about that. So a calm tone, gentle touch, and validating their experience can help de-escalate tension. So it's not about controlling their behavior. It's about understanding what's beneath it. Now, I have some do's and don'ts. So, do's: give short, one sentence explanations, allow plenty of time for comprehension, and then triple it. Repeat instructions or sentences in the same way. Avoid insistence, just try again later. Agree with them or distract them to a different subject or activity. Accept the blame when something's wrong, even if it's fantasy. Leave the room if necessary to avoid confrontations. Come back again later. Respond to the feelings rather than the words. Be patient and cheerful and reassuring. And go with the flow. And practice 100% forgiveness. Memory loss progresses daily. And so this is something I found it on Alzheimer's Association website for San Diego area, I believe. Tons of great resources there, and we'll get more to that later. Now, here are some don'ts. Don't reason or argue. Try not to confront. Don't remind them that they forget, and don't question or research recent memory. And try not to take it personally. Now, if you find yourself doing these don'ts, don't be hard on yourself either. You're human. These things are going to happen. There are times that we're going to be frustrated, that we're going to argue, that we're going to say, don't you remember? I just told you this, because we are tired. It's a lot of work. And so I want to add another don't, which is don't be hard on yourselves. This isn't meant for perfection, right? These are just things to aspire for. Now, some self-care tips. You can't pour from an empty cup. Your physical and emotional health are just as important as your loved ones. I find that a lot of caregivers, they ignore their own health, right? It's important that each of you take care of yourselves because you are just as important. And caregiving is a marathon, not a sprint. Rest when you can, accept help, use respite care if that's available, join a support group. I think that's the biggest thing that I want you all to hear is join a support group, get a community. And you're doing an extraordinary thing. But like I said, you're still human. Give yourself some grace, set some boundaries, let go of perfection. You matter in this equation. Now, these are some community resources. So we have Alzheimer's Association, Alzheimer's Foundation of America, and they go beyond just Alzheimer's. National Institute on Aging, and then here's their website, and then Family Caregiver Alliance. And so if any of you want to take a screenshot of this page, I suggest you do so. I'll give you a moment. And then we have financial resources that are available because this can actually be quite costly. I suggest taking a screenshot of this page too. And so you have the National Council on Aging, you have Alzheimer's Association, Medicare and Medicaid, Family Caregiver Alliance, and some state and local programs. So go to these websites and take a look. And just a reminder, I'm Dr. Shannel. I work at brain-centric neuropsychology. And what I do are neuropsychological evaluations, really identifying cognitive strengths and weaknesses, and clarifying type and stage in dementia, and support diagnosis and treatment planning. I also offer consultations. So think of it as personalized guidance for caregivers and families, helping people identify and navigate next steps, and education on what to expect and how to prepare. And then I do therapy and emotional support as well through caregiver groups and individual practices. And then here's my contact information. So if you would like to take a screenshot of this page too, feel free to reach out. Okay, thank you all so much. I see there are a couple questions in the chat. Someone asked about insights of normal pressure hydrocephalus. Is there a specific question about it? Or just about what it is or the treatment?
Yes. Hi, this is Susan Harris. How you doing? Nice to meet you.
Hi,
And
you too.
appreciate the insights today. Yeah, this NPH is something my mom has been diagnosed as having, and I've never heard of it. And it's causing the same kind of symptoms that you've identified as dementia. And so there's just not a lot of information out there in terms of, I've talked to neurologists who did the initial MRI, and she did talk to me about a couple of options. One is surgical. Another one is like a spinal tap as another option to take some of the fluid off of the brain. But there's just not a lot of information around other options and what can I do as my mom continues. She's 85. She's doing relatively well. Motor skills are pretty good for her age, but the confusion and all of those things I feel like they're progressing. And so looking for some insights around different options there's nothing necessarily a cure at her advanced age. Surgery is not an option. Like having her go through a full general anesthesia is just not something that she's willing to do or I. We talked about potentially doing it, having having them do the spinal tap, but not a lot of information around, does that work? What's the prognosis post? Is it worth it? Are there other options? So those are the insights I was looking for.
It's a good question. And something to know about NPH, it's actually one of the few treatable causes of dementia-like symptoms. And it is often misdiagnosed because there are cognitive impairments that may occur. You will see some gait disturbance and some urinary incontinence as well. Now, I've worked with multiple people with NPH, and I've actually seen good results from the surgery. And as far as the treatment goes, typically what I've seen is the shunt surgery, and a lot of people return to their baseline cognitive functioning following a surgery. Now, I am not a neurosurgeon. So it is best to go to a neurosurgeon to discuss this with. However, I have seen positive results following the shunt surgery.
And in those instances where you've seen positive results, what is the age group normally for the people who've had that surgery?
I've seen ages anywhere from 65 plus to around the age of your mother. But again, I'm not a surgeon.
Yes, for sure. We've talked to a neurologist and a neurosurgeon.
Yes.
Yeah. So that's just not an option because of her advanced age, that there's a risk of her coming out of that anesthesia differently too. So there's multiple things that you're juggling in terms of risk factors. Have any insights around the spinal tap? Have you also seen the pulling off of that fluid? Have you seen any improvement just by doing an initial spinal tap?
I have seen it. It's often used as a diagnostic tool to predict response to the shunt surgery. And so if symptoms improve following it, sometimes it's a sign that the shunting may help. Usually I see the shunt surgery.
Yes, that's exactly right. They said that having a spinal tap will help determine if the shunt surgery would be successful. But I just don't know how to really
It's hard.
mitigate.
Yeah.
I've talked to several anesthesiologists and they just don't have there is no rhyme or reason to how a person may react post surgery to the anesthesia. And so it's like another risk. Like, I don't want her quality of life to really diminish because of the anesthesia.
Yeah. You're really shedding light on one of the most difficult parts of being a caregiver, which is this huge responsibility that's on your shoulders. This is your decision to make. And there's a fear there of, am I making the right decision? Is this going to actually hurt my loved one more in the long run? And that can really be maddening. It's hard. Any other questions? And thank you, Susan, for bringing that up.
Yeah, thank you. Thank you for your feedback.
Of course.
Yes, I have a question. I'm suspecting that my partner's developing aphasia. He sometimes struggles to get the words out, and he describes it as knowing what he wants to say and not being able to think the word to say. And so there's that symptom that's starting to show. And then on the personality side, the values side, he's the kind of person who doesn't like to be told what to do or told what, and I need a tip
for helping him get curious about what's happening and talk to his doctor about it. I don't want to nag him.
Yeah.
The
Yeah.
more I say, the more resistant he gets. Tips about that?
Good question. I hear this a lot. So thank you for bringing it up. And a lot of times we see these subtle changes in our partners, and for various reasons, they don't want to go to the doctors or they don't want questions, or sometimes many of them know and they're scared to hear the answer. So they avoid it. We all have different coping styles. What I tend to suggest in those scenarios is to make it about the both of you. And so let's both go to the doctors together. We're reframing it in a different way. We're both aging. We should go check these things out. I had someone present to this caregiver group and said, we should all go to the doctor and do this one evaluation. Let's go together, making it kind of an us thing versus this is something that you should do.
That's good counsel. Thank you.
Oh,
Thank you.
yeah, you're welcome. And then seeing a neuropsychologist, they can really help assess the changes in language functioning. You can also do some imaging to see if there's anything going on in the brain. And you would want to rule out any like infections or strokes or any acute changes.
Thanks.
Yes, thank you.
I
Great question.
have another question. This is more organizational. I was online looking at the kinds of training provided through Medicare and Medicaid and other federal resources, providers. And I wonder what kind of training you find caregivers need that are beyond what Medicare and Medicaid will pay for.
That's a good question. So when you mean training, you mean like training to become like a formal caregiver?
No,
Or
or
see, or
coping.
just learn?
For
Or
coping,
coping.
skill, and yeah.
That's a good question. So what I find caregivers need are other caregivers. And then you share your resources together. That's why I love caregiver support groups. And in my group, I often remind everyone like, hey, if you find a resource, bring it up and share it with each other. And so one thing that I wish really existed in this world that doesn't really exist, I'm sure you could find it if you really look, is like after a diagnosis, people should really be directed straight to a social worker that could get you in touch with all the resources, but that doesn't happen. We often are just stumbling along and we find these resources one at a time. There are geriatric care managers that can be helpful that you can actually hire and discuss your situation, and then they'll direct you to the different resources. You can also go to different neuropsychologists that do consulting services. I consult, and we'll actually go through like step by step, like where's your partner or your loved one at cognitively, and then what are your next steps? Who should you be going to seek information from? So that might be for some people to get updated imaging. For other people, it might be to get in touch with the geriatric care manager or to find some additional support in your home. And that can be costly, actually having someone come to your home and help caregive. There are other ways. So you can do it through an organization where you're going to actually pay this company or organization to send you caregivers. Or some people just find someone through their church or their community that they pay. It tends to be less expensive, but they're also not necessarily trained in this. But some of the best caregivers I've seen have been those people. I hope that answers your question.
Very much so. Thank you.
You're welcome.
I also wanted to chime in just to let everyone know this is not an easy job. So I want to make sure that you give yourself grace. That's the first thing that I want to make sure that you do. You're never going to know everything. You're never going to know every sign and symptom of what your loved one is going through. Also, I want you to understand that frustration, it's normal as far as not understanding their disorder. So if you have situations where you're not understanding, it's okay to call their doctor and ask their doctor what you're feeling, that what you're seeing actually, if that is something that is normal. Don't just sit back and think that you're over exaggerating or you're just being frustrated with your loved one, because if not, it could be something like, I can say, sundowns. A lot of people don't understand sundowns. They don't understand when it happens. And it can be something so simple as they can sit in their room and you can go out the room. And as soon as the sun goes down, you come back in and they're hallucinating, thinking that someone's been in the room with them, someone has stolen something from them. And you're thinking that they're just having a cognitive problem, but really it's sundowns. And also urinary tract infections drives elderly people bananas. Like, it will take you forever to figure out that they have a urinary tract infection. So those things, please just make sure that you stay on top of it. If you see any kind of different symptoms or signs that's not normal, don't get frustrated. Just please just talk to their physician and tell them the signs and symptoms.
Very well said, Carletta. Very good point. Thank you for mentioning that.
Thank you.
One of our participants who had to get off, oh no, it was Denise. Denise is on, and she direct messaged me the idea that there are a lot of great aging movies out there that could be entertaining and thought-provoking and help make having conversations easier. And I wonder if people wouldn't mind just blasting any of those movie titles into the chat so we can share them onto the website.
One more thing, Dr. Shannel, is it possible that you can also list or give them the books that we spoke about?
Oh, yeah. Thanks for reminding me.
Actually, I want to make sure that they have those books and copies of those books, because they are phenomenal.
Yes. I'll actually grab them for you. I'm staring at them on my shelf right over my computer. One's called The 36-Hour Day, and then the other one is called Loving Someone Who Has Dementia. The 36-Hour Day reads more of, think of it as more of a guide, telling you like the different steps of things you need to accomplish or things to look out for, where Loving Someone with Dementia speaks a little more to the heart. So thank you for reminding me of that. And then as far as movies, Still Alice tends to be a popular one.
What one was that?
Still Alice.
Oh, okay.
Oh, I saw someone put that in a chat too. They put The Notebook. I didn't think of that. The Notebook is amazing. That is
What
a
was
great
the
one.
second book? I got the 36-Hour Day. What was the second book?
Loving Someone Who Has Dementia.
I have a quick question with respect to proactive care before someone reaches a certain level of decline. I notice little things sometimes when with family members, if they're calling and telling me the same thing that they may have told me like 2 days before and just not remembering that they had said it. And it doesn't rise to the level of significant cognitive decline, but just curious if there are vitamins or things that one can do when you see that you're not as sharp as the people are not as sharp as they used to. And myself.
Great question, Tiffany. And actually, and I'm really glad you said yourself included. So it's never too early or too late to start working on our brain health. And so what I typically advise are to really focus, what I touched on at the beginning, but I didn't go in depth, is I think of it as like pillars of brain health that are important to address. So being mindful of like sleep. Sleep is so important because something very special happens when we sleep. When we're sleeping, particularly in deep sleep, our body is actually removing the toxins from our brain that build up into an Alzheimer's disease process. So you want to make sure that you're sleeping. Also, when we don't sleep beyond the toxins, we're not really emotionally stable. I'm so guilty of this. If I don't get enough sleep, I let my husband know and everyone else, like, I haven't really slept a lot today, so I need a little bit of space, because that's also where we have our emotional consolidation as well. So number one is really make sure you're getting enough sleep. So just trying to have a sleep routine. Many people have insomnia, and so there's only so much we can do. But establishing things like a sleep routine can be helpful, and sleeping and waking around the same time each day or aiming for that is helpful. Another thing you want to be mindful of is exercise. And so the recommendation, which will look different for everyone, but the general recommendation is 150 minutes of moderate intensity exercise a week. Now, everyone's body and needs are different. And so that's just the general recommendation, but something to aim for. Another thing that's important is diet. And so there are two very popular diets in the research right now. One is a keto diet, and then the other one is the Mediterranean diet. And then you also want to be mindful of managing your stress. So I don't think I touched on this, but caregivers are at an increased risk of cognitive decline themselves because they're not taking care of these pillars that I'm mentioning. So it's not that dementia is contagious. It's that our bodies are not, we're not giving our bodies the time to heal because we're so focused on caring for our loved one. So managing our stress, being a caregiver is stressful. So maybe establishing a meditation routine or self-care. All these things can be helpful. And then you also want to be mindful of socialization. So there's tons of research on loneliness and isolation and how that accelerates aging. Really try to get in touch with your community, caregiver support groups. It doesn't even have to be a support group. It can be, let's say you really enjoy playing chess, joining a chess club and just playing with other people, right? Just setting time aside for yourself. And then the last is keeping your brain stimulated cognitively. So always remaining curious, striving to learn new information, really pushing your brain to remember things. All of that is helpful.
Wow. Oh, insight. Thank you so much.
Oh, you're so welcome. There are also supplements that help with brain health. However, I advise really going to a medical doctor for those questions because there are tricky things about supplements. They're not necessarily regulated. You really want to go to a medical care provider that has awareness around them. So I have my private practice, which is brain-centric neuropsychology. I also work at the Pacific Brain Health Center through Providence. And at the Pacific Brain Health Center, we have neurologists and psychiatrists that specialize within dementia. And they can give advice on supplements.
I have a question. I'm wondering, so my mother-in-law is 85. She had a stroke about 10 years ago. And I'm wondering if she likes to watch the 70s series Mission Impossible over and over again. Like it's every single day, all day, 24 hours a day, except when she's sleeping, of course. But I'm just wondering if that is a sign of dementia or if it's a sign of a neurological disorder or what.
That's a good question. I would need more information to say just that. But I do see that sometimes older individuals tend to want to watch the same TV series or they want to watch the same movie and over again. Now, it could be a sign of a neurodegenerative condition. It could also just be a sign that they really love this particular film. So I'd need more information. Sometimes I see people seeking the same film and TV series that have a neurodegenerative condition because it's actually within their long-term memory. So they're able to follow the story better. Whereas when they're watching something newer or more complex, it's difficult to follow the storyline. Therefore, it's boring or frustrating. So I would need more information to answer that. But I also sometimes think of it too as like a warm blanket. This reminds them of a certain time in their life or just something that they really enjoy. So that's where they find relaxation. Now, it is important, though, to switch it up because, like I said, cognitive stimulation is important. And so seeking new things is good for the brain, but it's also okay to repeat things as well.
Thank you.
You're welcome. Good question.
One more thing that I thought about as well, and of course, I'm not a professional, but I experienced it with my mom, is music. Music jogs the memory. It makes them remember things that where you would think they don't remember anything, but they will remember the whole song. And that helps to motivate them to want to get up and laugh and be happy. It brings joy to them. And also, it brings joy to you as well because it makes you see the light bulb go off in their mind and you're able to give them that positive feedback on, oh, you remember this song. Oh, great job. And it makes them feel really good, like they've done something really good because it's hard to actually, in the moment, tell them good job when you can't see the things that they're doing that are the older things that they used to do. So now you're seeing something that they are doing and it's, oh my gosh, they remembered it. And it makes you feel good and it makes them feel good as well because they feed off of your energy as well.
Well said, and a very good point. And there are organizations actually dedicated solely to music with those that have neurodegenerative diseases. There's one in the Los Angeles area that I love so very much. It's called Music Mends Minds. There is no cost. It's a place where people with neurodegenerative diseases, many of which that have complete memory loss, can go and sing and just be around others that are singing. And the joy that one feels whenever they're connecting to music, like you said, Carletta, is actually quite strong. And many people that have memory loss still can remember lyrics to some of their favorite songs from the past.
Doctor, I had a quick question around, and this is around the diet and preventative measures. Now, I have read in certain periodicals that the regular intake of caffeine can also be helpful. And I guess the caveat was that it had to be naturally received, like through tea or coffee. But 1 to 200 milligrams, which is the normal caffeine intake of a cup of coffee, I read was helpful in helping the brain. And I'm not a doctor, but just helping the brain stay stimulated. So just wanted to get your insights. Is that something you've seen in your research?
It's a good question. I take that to a medical doctor because what I see in the research about coffee is mixed. Depends on the year. Sometimes they say it's terrible. Sometimes they say it's great. And so coffee is a tricky one. Now, I love coffee, so I hope the research is great.
I'm sorry.
But
I'm really focused on caffeine versus coffee.
yes, caffeine, to say caffeine.
Okay.
That was just my love for coffee coming out. Yes. Yeah, the research on caffeine is mixed. So I would go to your medical doctor and ask them. Now, here's the thing. Each of you and your loved ones have a very specific mix of things going on within your bodies and your brain. And there's the general recommendations, and then there's what's good for you or for your loved one. You really want to seek a personalized approach. And so there are some doctors that do a one-size-fits-all approach, and then there are some doctors that really go for a functional medicine approach.
Okay, so we're going to start to wrap it up. It's getting close, so we want to stay on task. We have 5 minutes. We have one more question. We have one more question that needs to be asked, or has everyone had all their questions answered? If you haven't, you actually can reach out to Dr. Shannel, and I'm sure she'll be ready to assist. We will be having more workshops, and that will be June 20th. And we will be sending out the information for that workshop as well. So do anyone else have any questions before I close out?
Yes, Carletta, I was wondering, is there a website or resource to find caregiving groups or caregiver groups where you can join a community to get help?
Susan, you can actually contact me.
Okay.
I'll respond to your email with
Okay.
the information for the foundation, and then I can assist you with that as well.
Thank you.
Okay. And is that
And Susan, I also run caregiver support groups. So if you have any questions, I put my information in the chat too. So feel free to reach out.
Thank you, Doctor.
You're welcome.
okay? I just want to thank everyone for coming, and I want to thank Dr. Shannel for being here.
Thank you.
I am so grateful that you came in to give us this insight as far as what to do. If we had a little bit more time, I'm sure we could have got more into the caregivers side of support. But on our website, we will have all that information soon. We are slowly but surely putting those things up on the website. So you can just go back to the website periodically and we'll have more information on support and also in-home supportive services, how to connect with different workshops, and along with our dates of workshops that we'll be doing as well throughout the year. And
Aletta, would you put the website link in the chat, please?
yes,
Or maybe Katie could do that for you.
Katie, can you please do that? Also, if you would like to attend any of the other workshops or you have more questions and that maybe I can assist you, you can call the foundation number or either you can email me through the website and I can try to assist you with. I don't know a lot as far as resources, but I can try to guide you to places that I know that can assist you with resources as well. So if you've enjoyed the training, just let me know. I would love to have feedback. Share it with your friends and family about our Caregivers Day Out program. And if you can help spread the word, that would be great.
Thank
Thank
you
you
all
so
so
much.
much. Take care, everyone.
All right. Thank you.